itchy eyes, postnasal drip, and sneezing. If you suffer from allergies, these are all too familiar. And with the allergy season pressing on during a pandemic, there could be some confusion looming around symptoms.
So with COVID, you're going to get that cough, you're going to get that shortness of breath, you're going to get the fever, which you're not going to necessarily see with allergies.
We caught up with Kelsey Burger, Advanced Practitioner Lead at Hartford Healthcare Gohealth Urgent Care. She explained fever, fatigue, body aches, changes in taste are symptoms of COVID-19 and are not typical for allergies. If you suffer from allergies yearly, it's important to take note of any differences.
And the symptoms are not going to be as severe as they would be with COVID. If you're developing more symptoms than those itchy, watery eyes and that postnasal drip, I think it's always important that you come see a healthcare provider.
And the changing of the season brings changing foliage, prompting more folks to take that much-needed stroll outside, and grabbing that mask could help against not only COVID, but allergies too.
Going outside and everything like that, the thought that we don't need to wear a mask, it's not always 100% foolproof. So if you are going to not be able to social distance and you're still going to be within that 6 feet of somebody outside, we do recommend that you do wear a mask. But the good thing about the mask is it does kind of decrease your chances of having some allergy symptoms as well, because those larger allergen molecules such as the pollen and everything are not going to cross that barrier.
If you still have questions on whether or not your symptoms are allergy related or COVID-19 related, you're urged to contact your local healthcare provider, or you can head to an urgent care like the one that we did. In Vernon, I'm Rachel Piscatelli, Fox 61 News.